looking forward to the paradigm shift, Amit. Yeah.
Thank you, Prasanna, for making me part of this wonderful IC, and thank you, Dr. Aditya, for being our only audience. He is interested in the MIGS speaker who is about to come now. It's okay, it's okay. Thank you. Glaucoma, we know it's a big problem, the global impact it has. And blindness in glaucoma is very common. 4.5 million visually impaired, 3.2 million blind because of glaucoma. And 1/3 of those blind are in India. So 1.5 million people blind because of glaucoma in India, the biggest group of blind people. We are the blind capital of the world. And so there is something that is not going right with the current stepladder pattern that we follow in glaucoma management. Medications, majority of our patients are on medications, and once the patient comes into severe and advanced stage, only then we do a trab, and that fails we do a tube, and last we do a cyclodestruction. So that huge gap between medically managed people who are progressing in spite of their medications is something that we need to target, and that's where MIGS comes in. We know the problems with medical management, biggest problem being compliance issue. 40 to 60% of our patients don't adhere to their medications, ocular surface disorders, systemic side effects, poor quality of life because of multiple dosage every day, and dependence on their family members. And fluctuations in IOP is another problem. And these things can be solved by surgery, but till now, before the advent of MIGS, surgery, like I told, was limited to severe and refractory glaucomas, because there are certain risks of these invasive surgeries, and that outweighs the benefits that we get in mild to moderate. So this huge gap is to be filled by minimally invasive glaucoma surgery. Minimally invasive glaucoma surgery, as we know, is it's a wide range of implants, devices, and techniques which utilizes small incisions. There's minimal trauma, quick recovery, and favorable risk profile. So you have so many now worldwide. Here in India, we have the IC122 group, we have the trabectome limited amount, we have the KDB, GAT, suture GAT, we have the ECP also. The genesis of MIGS, it started with the development of devices. Basically, first, actually, if we consider ECP came the first, then came the trabectome, was the first device to get US FDA approval, and then came the iStent from Glaucos. 2004 trabectome, then the iStent. These are the milestones in journey of MIGS. 2015 KDB got a. So these devices are not very new. They're more than a decade old now, and worldwide there have been landmark studies on MIGS. There has been global acceptance of MIGS, spearheaded by the United States because of their early FDA approvals and extensive clinical research. Also because of the comprehensive training programs that they have for surgeons, and establishment of MIGS as a standard care of treatment in many institutions also there. European countries followed suit, and they also have shown significant interest in MIGS, with many of them adopting it as soon as almost the US. The Asia Pacific region also, and other emerging markets also, the adoption of MIGS has been steadily increasing. Factors like improving healthcare standards, increasing awareness of glaucoma treatments, and of course the prevalence of glaucoma itself in these regions is the highest. Global acceptance, if you see the US trend, right now majority of the surgeries that have been done in the US for glaucoma is MIGS, and that level is almost 10 times that of trabeculectomy and glaucoma drainage implants. So efficacy, if you look into efficacy, there have been multiple studies. These are studies for the iStent group, randomized controlled trials, prospective case series, all showing good and sustained release for over 5 years. What more do we need? Efficacy, this was a recent meta-analysis of 1000 plus eyes for eye stent devices, which is probably the biggest group in a study. Similarly for KDB, similarly for other MIGS devices also. I'm not saying only about the eye stent, I'm talking about all MIGS. So we have multiple studies which prove their efficacy of these devices. Safety is the hallmark of MIGS, and the major complications that you can get is transient hyphema and some IOP spikes in these MIGS that we do here in India, which can be managed conservatively. Again, reoperation rates are very low, almost 5%, less than 5% in many cases. If we compare it with filtration surgery, the complication rates are significantly lower, the recovery time is much shorter, post-operative care is less intensive, timing of the intervention is, we can intervene much earlier in the disease, and that's the main focus. Like I told in the starting of the presentation, that majority of our patients, they get a surgery done only when they advance into a very severe stage. But with MIGS, we can intervene much earlier to prevent them from having advanced visual loss. Quality of life impact is much lower. So I'm not saying everything is absolutely fine with MIGS. There are limitations, mainly the efficacy in severe glaucomas and cost and availability issues. That's the limitation. So to conclude, MIGS has revolutionized glaucoma management by offering a combination of reduced invasiveness, effectiveness, and enhanced safety. And this represents a shift from traditional, more invasive surgeries, providing a balance between a conservative management like medication and extensive surgery. So this, despite their advantages, MIGS has certain challenges, including limited efficacy in severe glaucoma cases and the cost issue. But it has created a paradigm shift in the management of glaucoma worldwide, and it's being high time that we practice it in India. These are the references. Thank you.